Hi, class. It's Dr. Lindner. Let's take a look at cartilage, which falls under supporting connective tissue, just like bone falls under supporting connective tissue. Cartilage is a network of fibers in a rubbery ground substance. It could be a firm gel, and it's made up of these polysaccharide derivatives called chondroitin sulfate. We know when people want to supplement to try and help regenerate their joints and the cartilage, they typically use glucosamine chondroitin sulfate, unless, of course, the person has some sort of severe allergy to shellfish. If they do have that, then they need to avoid that type of supplementation. It does take a while to get into the joints because remember, cartilage is avascular, so it's got to diffuse from adjacent structures. It's avascular. The chondrocyte produces chemicals that discourage the growth of blood vessels that are called anti-angiogenesis, right? Angiogenesis means blood vessel production, but anti-angiogenesis is against that. So that means all the exchange of the nutrients and waste products have to occur from diffusion. Now, the three types of cartilage that we have are hyaline, fibrocartilage, and elastic cartilage. Fibrocartilage is the strongest in the body, and fibrocartilage is also made up of type 1 collagen fibers, and a hyaline cartilage is type 2 collagen fibers, right? You know, a lot of people that are supplementing with collagen peptides, there's type 1 and type 2. Then, of course, we have elastic cartilage. So hyaline cartilage, there's no blood vessels or nerves, so the repair to them is very, very slow. Hyaline cartilage is found pretty much at the end of every freely movable bone, and it's designed to reduce friction at the joints at the articular surface. So it's sometimes called articular cartilage. The shoulder joint, the elbow joint, the hip joint, in between all of your phalanges, every freely movable bone has hyaline cartilage. When this is broken down mechanically, it's typically referred to as degenerative joint disease or osteoarthritis. These are interchangeable terms. It's not the same thing as rheumatoid arthritis. Rheumatoid arthritis is an autoimmune type of issue, whereas degenerative joint disease and osteoarthritis, this is more of a wear and tear type of disease. With rheumatoid arthritis, there are blood tests and blood chemistry that we can look at, typically looking for something called rheumatoid factor or RF that can show up on blood. Now, fibrocartilage, this is the strongest type of cartilage. The intervertebral discs are fibrocartilage. The pubic symphysis between the pubic bone and also the meniscus of the knee. These are all fibrocartilages, the strongest type of cartilage in the body. Again, it's made from type 1 collagen fibers. Elastic cartilage, these can kind of alter in their shape. They can stretch, they can rebound back. It's kind of sounds like elastic, right? Like a rubber band. It's got some elasticity. This could be found in the ear, the eustachian tube of the ear, the nose, the vocal cartilage, and even lots of the tracheal cartilage or the tracheal rings